Hello guys, welcome back to my channel Ages Kingdom. In this class I would like to take the topic from reproductive system, and from that I just has given a brief explanation about what are the parts of reproductive system. Especially I am dealing with female reproductive system. So in the image you can see very clearly what are the important parts of the reproductive system is. It starts with very important organ and vital organ, we can say, is uterus and cervix, the tubes which are connected to the uterus to the ovaries, the fallopian tube and the ovaries. These are the important structures of reproductive system. And we can see this already I have explained. So female reproductive system, very important things which we required is ovaries. From the ovaries hormones are released and the egg is released. Egg, we can call it as a ova, and it is helping for the development of embryo, and it gives birth to a newborn baby. And already discussed here uh, important major organs in the reproductive system: cervix, vagina, ovaries, uterine tubes, or we can say it as a fallopian tubes, and the uterus. And in this unit, very important thing, repeatedly asked questions are uterus. Draw the knee diagram of uterus or draw the knee diagram of female reproductive system. So when they ask that draw the knee diagram of female reproductive system, you have to draw this image, means completely starting from the cervix, vagina, ovaries, fallopian tubes and uterus. Sometimes they may ask you draw the knee diagram of uterus and write in detail. So in that case you have to draw only uterus and write in detail. So already cervix and all I have discussed, so I am going to discuss important question, that is, so when we speak about reproductive system, there are external organs are there, internal organs are there, but I am going with important question versions. I am going, so we can have a look here. This is the um, uterus, how it is looking like, and we'll go to the content. So what is the shape of the uterus? Uterus shape is pear shape organ in the female reproductive tract, and the upper portion which we can see here like a hill-like appearance, the fundus upper portion of the uterus where pregnancy occurs, and the cervix is the lower portion of the uterus that connects to the vagina and serves as a pathway for entering of the sperms to inside, and it is helping for the expulsion of the menstrual blood every month. So that's a major important function. And the uterus expands considerably during the reproductive process, means normally it has some measured sizes, but during pregnancy time it can expand up to the baby place, and the organ grows to the from 10 to 20 times its normal size during the pregnancy time. That is what I discussed here. And usually the main body parts of the uterus consist of upper portion we call it as a body, upper portion fundus, the middle portion we call it as a body, and the lower portion we call it as a cervix. So this is the major two parts we can say, fundus and cervix. So fundus is the upper portion and the lower portion we call it as a cervix. And in this, when you see inside the structure of the uterus, you have a three layers, same like heart is also covered with the three layers, like that in the uterus also it is covered with the three layers. So the three layers we call it as a endometrium, myometrium and perimetrium. So these are the three important layers you can see. So endometrium is the innermost layer which is helping for the pregnancy. I am telling you very clearly, endometrium is the innermost layer which is helping for the every month menstruation. If menstruation is not happening, it is happening with the pregnancy. And next one is myometrium. It is the main consists of form outer coat of the muscles and inner lining of the vascular and glandular structure we call it as a endometrium, and middle one is myometrium, and outer layer is call it as a perimetrium. So these are the shape and it is located in between the bladder and the rectum. The location of the uterus is in the pelvic cavity. It is located in between anteriorly with the bladder and posteriorly with the rectum. That is the location and the situation of the uterus, and it has three muscle layers. That is, innermost is endometrium, and middle one is called it as a myometrium, and outermost call it as a perimetrium. And it has two important parts. The first one is upper portion is fundus, and the lower portion is cervix. So this is what we have to see. And endometrium, when we are speaking, it is a vascular structure. Innermost layer we call it as a endometrium, and during the menstrual cycle the endometrium grows to a thick blood vessel rich and glandular tissue layer. It forms like that, and this represents an optimal environment for the implantation of the baby. It is helping for the this thick vascular structure is helping for the development of the baby. So, and here the word I can say is endometrium is like a fertile land where the seed will come and implant there. If fertile land is good, the seed also will be growing good. If endometrium is thick, thin, and it doesn't have a good vascular structure and it is not a fertile land, then if the baby or if the blastocyst comes here and attach also, it will not survive, because here soil or the land where it is fertilized, here the land is not good, and maybe seed is good but the land is not good. That's why for the growth of the baby, land and the seed, both, land is a endometrium and the seed is a baby, both are very very important. So that is the importance of endometrial layer. And endometrial layer, usually normal people, innermost layer we call it as endometrium. During pregnancy time, this endometrium only with thick muscular structure, it will be called it as a decidua. It is repeatedly asked question for 2 marks. Decidua, it is a pregnant state of endometrial state is called it as a decidua. And the endometrium is a central echogenic detectable using ultrasound scanner and has an average thickness of 6.7 mm. And during pregnancy, the blood vessels in the endometrium further increase in size and number, forming the placenta. And placenta supplies oxygen and nutrition to the embryo and fetus. This is about the endometrial importance. So when they are asking draw the neat diagram of uterus, you have to draw this total complete diagram of uterus, and you have to keep some headings like shape, size, measurements, layers, parts, and about the endometrium, all these things, and where it is attached, and where is the location, anteriorly how it is located, posteriorly how it is located, and laterally it is connected with the fallopian tube, and it is the uterus is suspended or placed in a pelvic cavity with some ligaments. So those all things you need to discuss, and you have to write the content for 15 marks. And if suppose they are asking for 5 marks, you can just keep side headings and you can write as usual. So that is what the importance of uterus, and you can draw the diagrams and you can write the content also. So if you really like my class, please do subscribe, and thank you.